Welcome back to Chapter 1, the second half of the PowerPoint presentation. Now that we've covered ethical theories, we're going to go into the values that drive ethical behavior. We're going to talk about some of the vocab words that are included in this chapter, and some of these words are like beneficence, basically meaning do no harm to anyone. Fidelity is loyalty. Gentleness is basically just being tender-hearted or kind. Humility, where you basically are being humble. It's the opposite of vanity. Justice would be fairness. Perseverance, where you're basically dealing with a steady determination. Responsibility is a sense of accountability. Sanctity, for respect of life, is valuing the sacredness of human life. Tolerance, basically respecting others' opinions and viewpoints. And then also work, an effort to basically move forward to get the job done. We're going to talk about the 7-step model for examining ethical dilemmas. One of the things that you're going to deal with is you're going to deal with determining the facts. Then you're going to define the precise ethical issue. You're going to identify the major principles, rules, and values. You're going to specify the alternatives, compare values and alternatives, assess the consequences, and make a decision. This is one of the models that ethical committees will utilize in evaluating cases. Another model would be Dr. Bernard Lowe's clinical model, where it's basically 3 steps, where you gather information, you clarify the ethical issues, and then you resolve the dilemma. Pretty straightforward, very plain and simple, but it's also another application that can be used on a medical ethical committee. The 3-step ethics model goes with, is it legal? It asks you the questions, is it legal? Is it balanced? And how does it make me feel? All right, we're going to go back to the 7-step model for examining ethical dilemmas and just kind to help you determine how this model is used and why it's used. Basically, the 7-step decision-making model is used to examine facts before we make an ethical decision. It forces an ethical committee to look at the facts very closely before a decision is made. This model can be used to examine all of the end of the chapter cases in this textbook. It's a very helpful model. It's a little bit more lengthy, but it does evaluate all the different aspects of the case. Dr. Bernard Lowe's clinical model, with the 3 steps of gather information, clarify ethical issues, and resolve dilemmas, is the most commonly used model in healthcare or a clinical hospital setting. Dr. Lowe emphasizes that patients should play an active role in decisions. So gathering information is very important, and the patient can be a part of that gather. Clarifying the ethical issues helps with that, and then you have the ability to resolve the dilemma, and you help solve the situation to where the patient is an advocate for themselves in this clinical model. The 3-step ethical model is one that's used most often because you could ask yourself these 3 questions very easily. You ask the question, is it legal? Is it balanced? And how does it make me feel? If you could answer the first 2 questions with a strong yes and the final question with a strong good, then the action is likely ethical. The 3-step ethic model is a quick way to check yourself when you are uncomfortable about an ethical dilemma. It is used the most often. At this time, we're going to discuss what ethics is not. Well, you need to be aware that ethics is not just about how you feel. It's not about the sincerity of the beliefs that you have or the beliefs that you have about the situation at hand. It's not about the emotional response, and it's not only about what religious beliefs are involved with it. Ethics is something that we need to be aware of because our determination of what is ethical or moral can have serious consequences in human action. Bioethics deals with moral dilemmas and issues resulting from advanced medicine and medical research relating to life. Examples of bioethics would be like cloning, stem cell research, and gene therapy. We're talking about the new advances in the medical field that bring about things that were never possible in the past. We are truly living in a science fiction type age to where we can do things that only people could dream of 20 years ago. Bioethicists are specialized doctors in the field of bioethics. Bioethics uses a form of moral analysis to assist in determining the obligations and responsibilities of unique issues relating to modern healthcare. Some of the 4 principles that can be used as guidelines to help when confronting bioethical dilemmas would be to apply the principle of autonomy, the principle of beneficence, the principle of non-maleficence, and the principle of justice. In hospital settings and medical settings all over the country, and for that matter all over the world, there are ethics committees that deal with all sorts of decisions that come up. Ethics committees are put together with a combination of physicians and medical professionals that help examine ethical issues relating to patient care. They contain a variety of members from many healthcare disciplines. Anyone can serve in the advisory capacity to patients, families, and staff for case review of difficult ethical issues if you are basically a medical professional. You can develop also and review health policies and guidelines regarding ethical issues on these committees. These committees also help with quality assurance. They help gather and evaluate information about services. They help put together quality of care within facilities. They examine results that facilities are putting out with the quality of care that they're giving their patients. And they compare information against a standard across the nation. Medical etiquette is the last topic within this chapter. And this course just wants you to be aware that there are certain rules or standards of professional behavior that physicians practice in their relationship or conduct with other physicians. But this medical etiquette also applies to all healthcare workers across the whole range of practices. You just want to give the common courtesy to everyone to call them by their official name and to give them the quality respect that they deserve through the practice that they are involved with. Another thing is anytime you take telephone calls from an MD, you want to take it promptly and you want to pass it on, because within medical etiquette it's also important that you get information to the physicians so they can basically treat their patients appropriately. In conclusion to Chapter 1, I want you to remember that you want to go through your vocabulary and you want to really know what these words mean, because you'll be utilizing throughout this course. You need to take a look at the different models for examining ethical dilemmas. You want to look at the 3-step model of asking you the questions of, is it legal? Is it balanced? And how does it make you feel? You want to look at the 7-step decision-making model of basically being able to evaluate lots of facts and details in a case and to give the best possible ethical decision that you can. And then there's also Dr. Lowe's clinical model that works with the gathering the information, clarifying the ethical issue, and resolving the dilemma, which also involves the patient as an advocate for their case. You want to take a look at those different models and you want to try to utilize them when you're looking at the points to ponder in the back of the chapter. So for example, under the points to ponder, under question number 1 where it says, should an alcoholic patient who may die of liver disease be eligible for an organ transplant? I want you to try to think about how would you apply those 3 different methods to determining what is the best possible outcome for this point to ponder. If you were sitting on a medical ethical committee, what would the decision be made on this? So during classroom time, we are going to be dealing with case studies, and we're going to be taking the 3 different models and we're going to be applying them to different case studies. Now, if you're in my online class, you're going to be doing the same thing within groups that are set up online. Now, at any time, my online students, if you want to come into the classroom setting and participate in the group case studies, you are more than welcome to do that, but you're not required to do so. Only the on-campus students are required to evaluate the case studies in the classroom setting. So if you have any questions, don't hesitate to contact me through email, and I look forward to meeting you and seeing you through this course. Thank you.